I'd like to welcome Jessica Bonzi and Anissa Key-Scott from the Mental Health Foundation, who are going to introduce their project, Amplifying Maternal Voices. So over to you.
Good afternoon, everyone, and it is a privilege to be here today representing the Mental Health Foundation. I am Jessica Bonzi. I am the project manager for Amplifying Maternal Voices, and this is Anissa Key-Scott, the project coordinator. So the project is currently in partnership with the Maternal Mental Health Alliance, who we work with along all the activities today.
So Jessica and I are both passionate about uncovering the perceived barriers to perinatal mental health and what prevents women from accessing mental health services. And this is quite a key underpinning theme of the project, the Amplifying Maternal Voices project. There's also a big focus on prevention coming from the Mental Health Foundation. So just to set the landscape and try and understand where we are currently and what drove us to choose some of the core themes for the conference. Just to point some of the key statistics here, we know that in the UK, ethnic minority groups have a higher burden of common mental health disorders when compared to a majority white population. We also know that women from white, other Asian or mixed backgrounds had lower access to community health centres and services.
And also one of the key themes of the project is breaking barriers, and barriers to ethnic minorities accessing mental health care conducted by the Maternal Mental Health Alliance and LSC found that a lot of the women felt that the reason why they didn't access services or even speak about their perinatal mental health was due to worrying that the healthcare professionals wouldn't think they are capable of looking after their baby, and also assuming that the feelings were normal. And that tends to be a lot for ethnic minority women. So if we just look at our own lived experience, just to kind of set some understanding. So I have 2 children. 6 years ago, my son was born premature at 29 plus 3 weeks. I was relatively young, so I was 25. And as a first-time mum, I didn't know what was happening. I've never seen a premature child before in my life. And it was like a lot of strange feelings, and I was feeling a lot of anxiety. And in my community, I'm from Ghanaian background, I was told that this is normal. What you're feeling is normal. You've had a premature child. All the experiences around breastfeeding and donor milk, for example, would be normal. So I didn't reach out and seek help for my mental health. There was not a lot of focus on the mother. The process is to go through the neonatal period and look about the cares and all the things surrounding my child. And then with my daughter in the second photo, she was obviously my second child, so I had more appointments. I got to see my baby more often. However, at no point was I spoken to about my mental health. I would enter these appointments, these scans, saying, I feel really anxious. I think the same thing's going to happen with my son. I was checking all the milestones, but I was never signposted about my mental health. And I was literally screaming out, like, I think my waters have gone again, because with my son, my waters went early. And for me, one of the main barriers for me not accessing services was I was told this is normal. What I'm feeling is absolutely normal. And that, I wasn't the priority.
Just to share a little bit about my personal experience as well, coming into the Amplifying Maternal Voices project. I've personally had both positive and negative birth experiences, which I think just really reflects the excellent work that's happening in the NHS at the moment. But unfortunately, my most recent birth experience, I experienced a postpartum hemorrhage, which was a very traumatic experience for me personally. And just to give an example of how I felt that barriers were created here, I don't feel like my concerns were listened to when I was communicating this. And just as a result of that, I did experience feelings of anxiety and isolation and, not feeling heard. And I also felt quite judged about the birth choices I had made. And just, bringing all of these factors together did have an impact on my mental health. but considering that I wasn't offered or signposted to any mental health support services, and therefore I went on a journey myself to not only create a platform for women to be able to do this, but also to build my own support network through private counselling, for example. And so, following my own personal journey into motherhood, I created a platform to support women, as I said, which is called Mum Bub Hub CIC. That's a community interest company where not only do we support women through pregnancy and the postpartum period, we provide them with the tools and resources to, you know, just to guide them through some of those conversations that aren't always had because there isn't enough time or resources to do so. And then leading on from that, that really drew me to the Mental Health Foundation, where the Amplifying Maternal Voices project was launched. And I really had a strong passion to reach more women and stakeholders, just in light of my lived experience and trying to understand what we could do to continue to break those barriers.
And in regards to my professional journey, my background is in local authorities. So in the beginning, I should have said me and Anissa both don't have a clinical background. I worked for a number of local authorities in looking at early intervention, prevention and diversion in children's services. I also have started my own community group around the Ghanaian community in the area that I live and bringing culture and custom and religion to the borough. And I also felt from my personal experience that there was a better way to support women. I want to advocate for women. I want my sisters who are now coming through and having children to not have the same experiences and know that they can seek out and access services when they need to. So, Amplifying Maternal Voices. So this project, as I said, is a partnership with Maternal Mental Health Alliance, and it aims to spotlight the maternal mental health experience of mothers and from less heard communities in pursuit of accessible care for all women and families. So the target or the priority groups that we're looking at are young mothers, women from Black, Asian and ethnic minority communities, the refugee and asylum community, and also women with long-term health conditions. The key outcomes is so that less heard communities have influence in priorities, that the barriers to access are recognised and addressed, and that the less heard voices are amplified nationally and locally via the VCSE organisations. So we have a number of activities surrounding the Amplifying Maternal Voices project. So we delivered a national conference earlier this year on the 1st of March, which reached over 200 multi-sector delegates. And we represented voices and experiences of less heard mothers, families and practitioners. So it was a fun-filled day, and Anissa will share some of the amazing lineup. We are also in development of a national engagement toolkit with the help that Maternal Mental Health Alliance are leading on, that will be trialled with local networks as a toolkit to encourage those who are doing great work on the ground, already accessing and helping women from the voluntary organisation and grassroots organisations. And then based from the findings of the conference, we are looking at launching a learning event and listening events that stem from the key themes that were processed from the conference.
So just to give a recap of one of the key outputs from our project, which is the Perinatal Mental Health Conference, which we hosted in March. We really put a lot of time together to make sure that we had a diverse lineup, because our core aim here was to bring together key stakeholders such as clinical representatives, but also grassroots organisations and those with lived experience, which was a core aspect of this particular conference. We've all heard today that it's really key to start bringing all of these different parties together so we can work in a collaborative way. And just to give an example, we had Professor Jacqueline Dunkley-Bent attending, who is the Chief Midwifery Officer of NHS. We also had representatives from different faith groups, which appeared to be quite a common theme that came out of the conference as well. And so we have some grassroots organisations from the Jewish community and Sandra Igwe from the Motherhood Group. But we also wanted to bring in the voices of those who are seeking asylum. And so we had research shared from Doctors of the World, just to name a few. And we really wanted to make sure that we continued on these themes to engage our audiences. Just to give an overview of some of the photos here, we've got one of our project managers from the Mental Health Foundation who is leading a breakout session here based on Young Mothers Connect. So as we said, this is one of the core groups we are focusing on across the project, and we do hope to continue and develop that as the project closes to see how we can continue the conversation. Just sharing here just some of the feedback from the event. I think we can both agree from the feedback that, you know, there was a lot of opportunities for people to collaborate. We had the focus breakout sessions where those with lived experience were able to share their own experiences and also offer best practice to those who work on the ground to really think about practical ways to move forward.
So, just to touch a little bit about the engagement toolkit that is being delivered. It will be a resource for individuals and groups across the UK who want to influence decision makers and create positive change in perinatal mental health care and in their local area. So we're hoping that it will inspire action at a local level and be a platform to amplify seldom heard voices. Some of the current themes from the conversation so far are listening and building trust. So what we've realised through the co-delivery, we're basing the initial pilot areas in Birmingham and Croydon, are that listening and building trust is one of the key things. These community groups are already working on the ground with these women. They don't want us to come and show them anything new. They want us to be giving them a platform to share the good work that they're doing and the best practice. The importance of being intentional. A lot of organisations come and want them to kind of bound together and kind of share funding and things like that. But for mothers, they know why they are reaching out to those certain groups. They're getting something from it. And we need to be intentional in the way that we engage with these organisations. To be flexible and person-centred, and the complexities and the issues around under-resourcing. These are the key themes so far in Birmingham and Croydon around the co-delivery of the toolkit. And obviously, small things make a big difference. So there's various conversations and group sessions generating ideas for the toolkit that we're looking at following sections. So breaking barriers being number 1, demonstrating impact, creating a safe space for women. And as Sian couldn't be here today, if there is anyone that would like to find out more or how to get in touch with around the engagement toolkit, her details are here as followed. Oops. Sorry, I'm butchering.
We're not finished yet.
Why is that?
So just to give an overview of where we'll be progressing to next, following the conference. So a lot of the core themes and feedback from the conference really focused on how we work together with community groups or even those groups within communities of that are faith-based. And so we really wanted to own in on that and also the experiences of women that are care leavers as well, parents that are care leavers. And so one of the next outputs that will be from our project is to develop a series of listening events upcoming within the next couple of months, just so we can bring together some of those leaders and also those that are already delivering best practice so that they can learn from each other. And we really want to sort of bring all of those elements together and then create sort of a small guide so that that can be shared within practices. Following that, the toolkit will be launched not long before we come to the end of the project. You've just referenced the toolkit, and then the learning events are our final evaluation of the project, where we'll be really looking at which cross-cutting themes have arisen and what steps we can continue as we develop the second phase, hopefully, of our project. So thank you for listening to our outcomes of our project so far and our future plans. We'd just like to pose a question to you to think about what else you can do to support perinatal mental health. dependent on what areas you're in. But if you could get in touch with us, if you have any ideas, we'd really appreciate that. And our details are here on the screen. Thank you.
Thank you so much. Thank you. Jessica, Anissa, thank you so much for sharing your personal stories and your passion to protect new mothers and their babies. If you have any questions, Anissa, Jessica, delegates can email you to ask you any questions, to find more at the Mental Health Foundation page. Thank you so much. Now